Good morning, Carla.
Good morning.
Oh, today we just gave you an appliance to wear at nighttime for sleep appliance, but we are done with your care about 3 months ago. Please tell me your story, how you met us, why we came here, why you came here. Tell us a little bit about yourself first.
Okay, well, around 2006 I started having migraines. I went to different doctors.
In where?
Oklahoma.
You're in Tulsa?
Yes.
Okay.
I was in Oklahoma at the time, and when I started working, I started having different symptoms of headaches. I couldn't really concentrate. I would see blurry. My migraines were taking just all of my life. And
who diagnosed your migraine?
A neurologist.
Okay. You said more than one?
Yeah, actually my neurologist, and also the internal medicine doctor that I go and see, like for regular checkups.
So how many medical doctors did you see for that one?
Probably like 3 or 4.
Okay.
And I went to different neurologists because nothing was working, even though I was on medication and stuff.
How many medications were you put on?
Well, I was taking painkillers. I was taking like probably 3 to 4 times a day, painkillers, all kind. Like Darvin and codeine and things like that, and that would just make my headache worse. I was taking sleeping pills like Lunesta and Ambien. I was taking migraine medication, but it was related more like to seizures.
Was it Topamax or
Topamax, I was taking Topamax, and they were increasing the dose, but it wasn't really helping.
What dosage were you up to?
I think like it was 10 milligrams maybe, but I don't remember exactly what
10 is pretty low.
it was. And then also I was taking muscle relaxants. But you know, the Topamax I went from like 5 to 10, and I think I reached 20.
20, yeah.
And
I have seen people that are on 100 milligram.
Yes.
And still not get any better before they came here.
Yeah, and I was taking, the muscle relaxants. So I was having a pharmacy at my house, pretty much, and nothing would help. So I couldn't go outside. I couldn't have a life. I was just I was a newlywed, and
Newlywed?
It was really tough.
So how old were you at the time? How old are you now?
I am 30.
30. And so you're talking 7 years ago. You're early 20s.
Yeah, I was really young when everything started.
Well, you still are young. Younger.
Yeah, younger.
Younger.
So there was a moment I was starting to worry about.
And what kind of work do you do?
I work in the oil industry. I'm a market analyst.
And you have a lot of education. I know you're kind of embarrassed about talking. What do you have? Tell me about your degrees.
Well, I went to Oklahoma State, and I graduated with a degree in international business. My second degree was in marketing. Then I majored in Spanish. Then I did a master's in engineering and technology management, and now I'm almost done with my MBA. So.
Very bright lady.
Thanks.
I want to bring that up because it is important. You're well educated, well informed, and then go on ahead, please. Then this was going on as a newlywed, having all this.
Yes, and then somehow I started to notice that I was clenching a lot. My husband told me that when I sleep, he could hear my jaw actually like popping and all the cracking like. So I went to his uncle, who's a dentist, and he recommended me to go to a person that in Tulsa does TMJ work. And I went there, and actually he gave me a mouthpiece, but he made it worse.
How long were you under his care?
Probably like a year or 2. And then I started researching online to see. So
during that 2 years of treating by the TMJ specialist in Tulsa, you were seeing any improvement at all?
No, not at all.
Okay.
It actually was worse.
Worse?
I think the position of my bite was totally off.
How did they determine the bite? What kind of steps did they go through?
He told me open my mouth and then move my jaw forward, and then that was it. So, and he didn't really ask me anything else. Then he told me that I probably was going to need braces, but it wasn't scientifically. It was just whatever he thought. So, and
the reason I brought that up is we'll later contrast what worked for you, because that is not uncommon to kind of make an educated guess.
Yeah, it was a really educated guess.
Okay.
It was a guess.
Okay. You won't even go the educated part. All right. Go on, please.
Well, so then that didn't work. So I started doing some research online, and then I found a doctor. His name is Dr. Winters.
Kevin Winters.
He was really nice, adorable, really nice office, and he did help me. He gave me a mouthpiece, and he did help me.
Before he did the mouthpiece, what did he do different?
He actually connected me to the machine that look at
measure
my
the muscles.
And I spent like a whole day with him, and he was like looking how I sit down and how I walk, and it was totally different approach. And then he told me that he doesn't do braces, but
he helped a lot.
yes, he did help a lot. And then he told me that, I asked him, well, what should I do now? And I asked him, what would you do if I was your daughter? What would you tell me to do? And then he told me, well, a person that I will totally trust is Dr. Rahman, but he's far away. And I was like, okay, where is he at? He said, Kansas. I said, okay, then I'll go there. And that's how I end up here.
I see. And you said earlier about that time, if it was China, you would have gone.
Yes, I would have gone anywhere. I was really desperate.
And why were you desperate?
Because I didn't see a solution. I thought this was going to be it. I was going to have to take a lot of medication for the rest of my life. I probably wasn't going to be able to have kids because nobody can have kids on medications. It's not the best scenario. And who wants to have a baby crying when you have a migraine?
Well, since you brought up the baby, you now have a baby.
I do have a baby now. Actually, I got pregnant after 1 year and a half of treatment with you because
By
I was
then,
really good. I left, and I don't take any medication. I'm totally med-free. So.
okay. Well, let's go back to after when we met. We did some of similar things to Dr. Winters in finding out where the jaw should be. I made some further changes to refine the jaw even better. I say better because I think you got even better after that one.
Yes, yes, and your treatment was a little bit more, like, it was deeper. So, you moved all of my teeth, and they grew, just changed my bite. It was something permanent. It wasn't just a mouthpiece that I take in and out. I had to actually eat with my temporary teeth. And
You're orthotic, fixed orthotic.
so it was more of like a final change instead of just putting the mouthpiece in and out. So.
Okay. And then you had a treatment, your neuromuscular functional orthodontics, which is what we did for you.
Okay.
And that took about 2 years. Okay. At what point did you start? In the beginning, you had fixed orthotic, and then we started with the braces on the top, and which is neurovascular functional orthodontics.
Yeah.
At what point did you notice improvement?
Honestly, I started feeling better, like maybe 2 months after we started treatment. I started feeling better immediately. After you changed my bite, like as soon as you put that on my mouth, I started feeling better. So it was pretty fast. I did notice a change really, really fast.
And what point were you able to get off the medications?
As soon as you put my...
Oh, right away?
Yeah.
I
yeah.
see.
It was really drastic change. All suddenly, I just stopped taking all of my medicine because I didn't really need them. Something I also I tried Botox on my muscles. I actually went international, and before I knew you, they put Botox like on my muscles in my head. And that was, I was desperate, so I tried everything. So
I understand.
I did try anything.
Yeah. I'm glad you brought up Botox. And who did that for you?
I was a neurologist, but it was in Colombia.
Oh.
It wasn't here in the States.
Okay. Okay.
And
So-
then here, they do that as well, but the insurance doesn't cover it. So before I met you, I actually went to a pain specialist.
Pain management specialist.
And he put another kind of painkiller relief medicine
Where was it put in?
here on my...
Anything on the neck at
No,
all?
no, it was just in here, and it was really painful. It was just here. And then that's what they did here, but that didn't really work.
So you had Botox, you had other pain management, and of course a lot of medications. You tried them all before. And then how about chiropractic? You mentioned that too.
Yeah, I went to a chiropractic for like 2 years, 3 times a week. That didn't help either.
Okay.
That will help for like if I have a pain in my back or something, but my headaches, they just stay no matter what.
All right. So, so once we went through the neuromuscular orthodontics and got that all done, you've been pain-free for a little more than 2 years now.
Yeah.
Okay. And at what point did you feel comfortable, all right, time to start family?
That was, probably like 7-8 months after we started treatment.
Because you felt comfortable this is going to be good.
Yeah, I felt that I wasn't going to have to go back to meds or anything. So.
You have a little boy.
Yes.
You're telling us earlier about a year old.
Yes, he's 1 year old.
What's his name?
Joseph.
Joseph Carlos. Right?
Yes.
And keeping you very busy.
Yes, extremely busy.
Okay. So What would you tell somebody that is going through some of the symptoms you're having? You even said one time you almost wanted to like give up or something. Tell me about that.
Yeah, I was just getting really depressed. I mean, I just didn't see a hope. I didn't see the light at the end of the tunnel. It was just really bad. I was just depressed. I couldn't get out of my house, so I just thought that wasn't a solution. But what I would tell people is, you need to recognize that it can be your bite. A lot of people are hesitant to think that your bite can cause all of this.
How the jaw lines up.
So that's
the reason I wanted to kind of butt in there is that bite to dentist means where the teeth fit, where they come together. Mm-hmm. What we do differently is figure out where the jaw should line up and then make things line up. That's what I wanted to clarify.
Yeah, and a lot of people don't, I mean, they don't understand. And I think it's because they don't read, they don't do research. But yes, in my case, it was just my alignment of the bite. Mm-hmm. So.
You would remember, one of the first things we did in the beginning is to ensure that's really going to solve it for you first, before you did anything permanent.
Yeah.
Granted, you already got a lot of improvement with Dr. Winter's removable orthotic, mm-hmm. but only after I did the fixed orthotic, the new, improved even, and make sure everything works before you even decided to go further. And you didn't acknowledge earlier, costs a lot of money, and also a lot of travel time.
Yes, it does cost a lot of money, but for me, I think it was the best money I could have spent, because if you don't have health, you cannot do anything else in your life. So you need to have health to be able to work and be happy and go out and travel. And so for me, it was worth every penny. I would pay it again, if I was in the same situation. So.
Well, thank you.